and welcome back to another video of Medic Notes. This video will be on Myasthenia gravis. Myasthenia gravis is an autoimmune disease mediated by antibodies to the nicotinic acetylcholine receptors. And these receptors are found at the postsynaptic site of the neuromuscular junctions. So this is a picture showing you can see the acetylcholine receptors at the postsynaptic site. The clinical features of myasthenia gravis include a slowly increasing or relapsing muscular fatigue. And the muscle groups that are affected in order are extraocular muscles, bulbar muscles causing problem in swallowing or chewing, face muscles, muscles in the neck, limbs, and then the trunk. The signs that we should look out for during physical examination are ptosis, which is drooping of the eyelid, diplopia, myasthenic snarl on smiling, peak sign of orbicularis fatigability, where the eyelids begin to separate after manual opposition to sustained closure of the eyes. Dysphonia is a rare sign where on counting to 50, 1 to 50, the voice of the patient slowly fades off. Usually tendon reflexes are normal in myasthenia gravis. So the symptoms might be exacerbated by a few conditions, which include pregnancy, hypokalemia, where there is low potassium levels, infection, overtreatment, climate change, emotion, exercise, and medications such as gentamicin, opiate, tetracycline, quinine, and also beta blockers. These are the investigations that we can do, which include antibodies testing, where in 90% of the cases there will be increase in the anti-acetylcholine receptor antibodies. If this antibody is negative, we should look for this muscle-specific tyrosine kinase antibodies. Electromyography can be done where the expected finding would be a decremental muscle response to the repetitive nerve stimulation. Imaging such as CT scan to exclude thymoma. Where there are also other physical examination where we can try to apply ice on the eyelid for more than 2 minutes. Then the positive finding would be ptosis improvement by more than 2 millimeter. So means that there is less drooping of the eyelid after ice application. However, this test is not a diagnostic examination. There is also another test called the tensilon test, where adrophonium is used, but this test is rarely used. For treatment, we treat for symptom control by giving anticholinesterase such as pyridostigmine. However, take note that there might be some cholinergic side effects such as increase in salivation, lacrimation, sweating, vomiting, and meiosis, or other side effects like diarrhea. Immunosuppression, where we treat relapse with prednisolone. And there are also other drugs that may be used, such as azathioprine, cyclosporine, and mycophenolate mofetil. Another treatment is by doing surgery, thymectomy. And this can be considered especially in younger patients with onset less than 5 years, and if they have poor response to medical therapy. There is one more condition that can be caused by myasthenia gravis, which is the myasthenic crisis. And this is an emergency life-threatening condition where there is weakness of the respiratory muscles during a relapse of myasthenia gravis. So when there is weakness of the respiratory muscles, the respiration may be compromised. So the immediate treatment is to monitor the forced vital capacity, and ventilatory support may be needed. Treatment can be done by giving plasmapheresis to remove the acetylcholine receptor antibodies from the blood circulation, or IVIG, and identify and treat the trigger for the relapse, whether it can be caused by infection or medications. Then we treat the infection or remove the medications first to improve the condition. That's all for this video. Thank you.